go to the ER. And the two medical students there argued with me about giving me 10 units an hour of insulin plus 20 units as an immediate bolus. And I knew that 15 and 125 pounds, that was way too much insulin for me. But because I don't have a medical background and I was just some teenager, they didn't take me seriously. And sure enough, a few hours later, I was crashing and they were pumping me full of sugar to counteract all the insulin they just gave me.
My father's a diabetic with, bad coronary artery disease, who's got care at 3 different hospitals. When the folks at Hospital X don't know what happened at Hospital Y, they're not giving him really good care.
If your records are in Boston and you're in North Carolina or you're in California, there's no way to bring it all together.
You get subjected to multiple x-rays you didn't need multiple of. There are exams that you needed, tests you needed, things you needed to do that actually didn't happen because people didn't realize that hadn't been done.
Not only does that mean that there's waste in terms of money and a burden on the healthcare system generally, it means my mom gets hurt. If I could snap my finger and have one thing transform the quality of care in the country, it would be that everyone would have an electronic health record that would be universally accessible.
We feel like we have a responsibility and a bond to every patient who we care for. The problem is that with a paper chart sitting in front of you, it doesn't give you information that's up to date. It doesn't help you make connections. It doesn't help remind you of things that is buried in the chart.
The current system means that the information that's required is frozen in glaciers. So you need to go and ship it out of the glacier to find what you need to make good decisions. Our goal with this work is to have the information that's been delivered to your patient available there when you need it, so that you can make better decisions with your patient for their care.
Their health has to change. And that actually has to move toward one that actually coordinates care for patients, one that actually understands what's going on with a patient, a population of patients.
It's about getting rid of the clipboard that you annoyingly have to fill out every time you go see even your own physician who should know you.
To collect information from multiple parts of the healthcare system, put it in one place that makes it easier for families to manage.
The record files the patient, so when the provider sees the patient,
every other sector of the economy use information technology to drive massive improvements, efficiency, quality, service delivery. Healthcare hasn't yet had that opportunity.
It's almost a historic convergence right now, and maybe we get the job done if we just really all do that together.
So the opportunity is better care, better health outcomes, better coordination of care, and with luck, reduced costs and efficiency.
If you have the ability to do something good now, why wait till later? Why not take advantage of this opportunity?
As you saw in the video and heard from some of the medical industry's leading professionals, the timing is now for a convergence between both the medical and technology industries. Not only is there the opportunity for better quality of care and the potential to lower medical errors, but there is an overwhelming need in the U.S. to lower the cost for healthcare, and your solution is Singularity. My name is Taylor Linke, and I'm here today to present you with an opportunity for a sizable profit potential and solution for the healthcare industry. As a nation, we spend twice as much on healthcare as we do on food. We spend nearly $2.5 trillion on our healthcare and $1.2 trillion on our food. As per a study by the Harvard Medical School in 2008, administrative automation may result in saving 5% of the total healthcare spending, or nearly $100 billion in the U.S., by reducing adverse events such as medical errors, drug events, One study estimates that measurable medical errors cost the U.S. economy $19.5 billion in 2008. So who are we? We are Singularity, a startup company that is going to create an industry-leading portfolio of integrated, secure, open-source system solutions that simplifies connectivity for the patient and healthcare practitioner across common platforms. We're going to utilize the targeted EHR solutions, and I'll explain what those are in just 1 minute, along with the empowerment of the patients and a fully integrated open-source software. So our concept is ready to capitalize on significant market opportunities. So who is the foundation of Singularity? Well, Jefferson Messias is a graduate of Arizona State University in supply chain management, and he brings 10 years of experience in supply chain as a global customer responsive experience for Intel Corporation. Jeff is currently a senior manager at Intel, and his experience and leadership will position our company to fully embrace the reality of information technology in the healthcare sector. Rolf Lorenzen, he is a graduate of Washington State University in Finance and Accounting and the Executive Leadership Program at Cornell University Johnson School of Management. He brings 17 years of experience in international strategy, and he has been a catalyst for driving business development in the wireless, retail, and cruise industries. His skills will be absolutely necessary for the company in formulating the vision and mission into tangible strategies that will drive success and increase shareholder value. Keon Garraway is a graduate of Brooklyn College in Economics and brings 6+ years of experience as a lead financial analyst in real estate asset management at New York City's housing development. Keon's asset management capabilities brought about significant cost savings to his corporation by preventing loan defaults and by planning and coordinating needed capital repairs. I myself am Taylor Linke, and I'm a graduate of Arizona State University with a bachelor's in marketing. For the last 10 years, I've been working for the Washington State Department of Health in the regulation and licensure of healthcare practitioners. Through this position, I have been able to understand the need for the electronic integration in the healthcare industry to help reduce the number of errors and problems that the medical practitioners face. So earlier I said that I would explain what an EHR is. An EHR is an electronic health record, which essentially is an evolving concept which is defined as a systematic collection of electronic health information about individual patients or populations. This is something that could come in a digital format and is theoretically capable of being shared across different healthcare settings. EHRs may include a range of data, demographics, it could be patient charts, could be immunization status, test results, all sorts of different information that comes at the touch of an electronic device. So what is the Singularity solution? Well, it's a patient-focused software that's going to provide empowerment, simplicity, and a user-friendly application for the patient. In terms of empowerment, one of the best features that separates Singularity from the other applications out there on the market today is something called Doctor Score. Now, Doctor Score is a program that essentially patients can have on their phones or their mobile devices, iPads, things of that nature, that will link and cross-reference with the state regulatory databases and will allow patients to see the licensure and disciplinary histories of their practitioners within, say, a 10-mile radius. This way, the patients feel empowered and have more opportunity to make an informed, educated decision before determining which practitioner they're going to go see. Our software is going to be simplistic. It's going to allow for user-friendly applications like appointment reminders and immunization or vaccination histories. This software is truly going to revolutionize the way patients and practitioners integrate across their medical appointments. For our practitioners, again, it's going to be user-friendly. There is an example of what an electronic medical record could look like. It's going to increase the accountability for our practitioners. There'll be drug interaction cross-reference manuals so that, say, for example, a doctor is going to prescribe one type of medication to you as a patient. Before they actually prescribe that medication, they'll be able to take advantage of the cross-reference manual to ensure that there aren't any potentials for harmful interactions with that drug and, say, some type of other prescription that maybe a different practitioner has prescribed for you. It's also going to allow for increased efficiency and increased profits for those healthcare practitioners. And I have a specific example a little later on in the presentation that will break it down into what exactly the dollar profit increase will be for the practitioners. So why now? Well, it's a market that is ready. Our latest market intelligence corroborates our view that the healthcare industry is ready for EHR solutions. Through the ARRA High-Tech Act, which is a federal regulatory act, there's been an enforcement-driven need that's been created for our healthcare providers to buy and maintain EHR products and solutions. The dominant players in the industry currently, like Allscripts, have focused on the large hospitals and physicians and ambulatory surgical facilities. This has created an untouched segment of the market for the independent healthcare practitioner and smaller clinics, which is where Singularity is positioned to take advantage of and gain market share. National trends show patient safety, rising healthcare costs, quality control, and federal mandates are pushing this EHR solution. Right now, the market sits at roughly $15.8 billion, and by 2015, that's expected to essentially double to $31.9 billion. And there's a significant opportunity. At a 14% annual growth rate, EHR solutions are needed across the medical profession, and Singularity is the solution that we want to be providing. The current global market is at $19.7 billion. However, for Singularity, our initial implementation plan calls for focusing on the North American market, which is roughly 50% of the overall market share and is growing at 10%. Our business concept is simple. We're going to focus on both the patient and practitioner-focused software, as well as the small to medium practitioners' offices and selling them our EHR solution, and the patient-focused solution. Now, remember that I said there's a federal regulation that's mandated that healthcare practitioners integrate an EHR solution in their offices. Now, with this mandate also comes $44,000 from the federal government to do such implementation. And our product we're offering to the medical practitioners at $22,000 for the initial installation and setup of all of the software. This leaves the practitioner with an additional $22,000, which is why we believe that our product is going to entice these small to medium-sized healthcare practitioner offices. In addition, we talked about the patient software, the doctor score application, things of that nature. And these will have one-time selling fees to the patient, which they'll be able to download to their iPad, iPhone, or other handheld electronic device. Now again, earlier I mentioned that we had a specific cost savings example as to how the medical practitioner could save money in their office. Here we'll use the automated refill service, which is just one example of how such a cost savings could be incurred. Now, the average staff time currently spent to do a paper refill in terms of minutes for a prescription is 15 minutes. The average staff time per an electronic medical record refill is 3 minutes. That's already a savings of 12 minutes. Now, if there's 400 prescriptions per clinic per week, then the total time saved in prescribing hours is 4,160, which translates into nearly a $71,000 savings for that healthcare practitioner's office. And this is just one additional reason why we feel that the small to medium-sized market is going to want to take on our solution and integrate it into their offices. So where is the funding going to come from? Well, we're estimating that our initial startup funds we're going to need are $7 million. This includes our capital startup and our operational costs for year one, which are similar in that they're both a little over $2 million, and continued research and development to thwart our competitors' attacks on our solutions and software. And we estimate that by year 3, we'll be profitable with an $11.7 million profitability, and our net income will be $4.8 million. And by year 4, we'll be able to recoup your $7 million initial investment. So what do you get for this $7 million initial investment? Well, you're going to get 40% of our corporation's common stock, 15% in cash returns, and 2 seats on our board of directors. Here you can see our break-even analysis, and this is the one that we did that puts us at break-even at year 3 with 118 units being sold. You see the unit selling price listed just under $22,000, as I mentioned, and again, the federal government is going to be providing $44,000 to the healthcare practitioner to implement their EHR solution. So at our cost coming in at $22,000, that's a great selling point. And we have our returns estimated at 5%. So again, I mean, there's really this opportunity for both the healthcare practitioner and for the patient to receive great benefits from our open source integrated solution, and we feel that Singularity is really going to, as I've mentioned, this is currently a fairly fragmented industry. They'll be primed and ready for consolidation over the next few years. And as more and more companies attempt to incorporate their EHR technologies and applications such as ours into their business models, our exit strategy is going to be attractive enough to be acquired by one of the larger industry players, such as Microsoft or Allscripts. In order for this strategy to be successful, we're going to have to exploit our niche. And some advantages to this strategy are high liquid cash assets, as well as the current corporate management structure can continue on. So we hope that you've been interested by our presentation, and my contact information is listed below, and thanks